big issue with this storm, at least initially, is going to be flooding from South Carolina.
More than 300 roads and bridges are closed across the state.
This is dangerous. This is very real.
At least 9 people have died in South Carolina following what officials are calling a 1,000-year storm.
County, the fire chief tells CNN one man was found clinging to a tree.
The death toll stands at 21 in the Carolinas.
Reports of their homes, roads and bridges are closed, and clean water has been cut to thousands.
Thousands of residents in pockets of the state are also dealing with power outages and contaminated water due to sewage overflow.
The rainfall amounts, as you've mentioned, are staggering.
27 dams have failed, 129 are in jeopardy, and more than 300 roads and bridges remain closed.
According to the governor, about 550 roadways and bridges are closed, some completely washed out.
Tonight, David Begnaud reports from a community completely cut off.
On a sunny Sunday in South Carolina, Dr. Lizina Green used a boat to make house calls in a disaster zone.
It's amazing because I drive this road all the time to do my home visits to see patients that live out here, and there is no road.
It's funny thing, I don't listen to the news, so I didn't even know that we were having a any type of hurricane or depression system. I found out from my 7-year-old.
No one had any idea the amount of water that was coming into the rivers. And you know, rivers from above us and all around us started flooding and dams started breaking, and before you knew it, little town of Andrews was really struggling to stay afloat.
I was actually trying to make my way home, and there was water all over the roads, covering the roads, which was making it difficult. Roads and bridges were washing out.
We're only seeing, it felt like maybe 20 patients a day. None of them could find a safe route to get here or to any of our other locations.
And started getting calls from our patients who were stranded from the flood waters, that they needed their prescriptions.
And so we just decided that something needed to be done.
We just started calling people, and we contacted Mr. Irvin Lambert and asked him, hey, would you be willing to fly us over to Big Dam area, take medical supplies, and check on some of our patients out there.
So we emptied out our sample closet. Reynolds donated medications, Fred's donated medications, Tidelands donated medicines.
And loaded all of that up and went and met Mr. Irvin Lambert and took tons and tons of supplies and multiple trips via helicopter to Big Dam to help serve the community.
It really just blew me away. I knew there was a lot of water. You see pictures on TV, but it does nothing. It does nothing for what you see in person.
It was pretty astounding, the extent of the flooding. You don't realize how much is flooded from the ground, but then as you're up in the air, you could just see the amount of water that was everywhere. Roads that I had driven to do home visits were completely flooded.
It was really and truly devastating. And it still gives me the chills to think about it. It was really, really heartbreaking that all of the damage and all of the people who had been displaced from their homes, and realizing that how early on it was, and all this people had no idea what was going on.
Kids' playhouses and their little playgrounds, just, you know, the destruction it did, just to see those things floating. And you're thinking, you know, that's where a child played. And now that child's home is ripped away from them.
They were surprised that anyone would come out there in the first place and try to see how they were doing and check up on the sick, but very appreciative.
Went patient to patient through medications and tried to see what we had that we could help them with, maintaining safety, medication safety at all times. And from there we immediately started deciding that we needed to find out somewhere else that we could go help.
Day 2, that was probably about the roughest day that we had.
We had found another community, Bloomingvale, needed some assistance, and that they could not get out and could not get to where they could get some medical care, get their medications.
We actually got in a boat right there on Highway 41 and traveled down 41.
Along with the help of many other community members and some people from Georgetown, we got a bunch of boats together and had emergency officials helping us.
There was a complete flash flood while we were in the water in a metal boat, and there was lightning, and we were taking on water in the boat. We were completely soaked. It was cold, but we did not turn back. That was not even an option for us, turning back.
It was so wonderful how everything was already set up for us. There was someone there waiting for us who put us in their truck with all of the supplies and drove us to Bloomingville, to the community center there, where they had gotten word that we were coming, and if people needed medications, to please stop by and see if we could help them in any way.
We had a lot of supplies, anything from dog food to, diapers, baby wipes, whole 9 yards, paper towels, anything like that.
We asked all around if there were any areas at Black River or anyone they knew needed medical care, and Big Dam had more people that could still go nowhere that really needed some more medical attention that weren't aware Friday night that we were there.
There was 3 boats. CBS, David Brogner, he went with us, and he interviewed Dr. Green.
Went to the church in Big Dam and delivered 2.5, 3 boats full of supplies, whether they were cleaning supplies, medical supplies, food, Clorox for all of the mold. Took all of that over there, and they had they had their fellowship hall set up like a big community center, and they were making boxes for people of cleaning supplies for people to take, and they were serving food to all of their community members, which they did 3 times a day the entire time that everyone was stuck on the Big Dam Island, as they like to call it.
It's already traumatizing to be stuck someplace because of floodwaters or to lose your home, so then to have to worry about your health was, to me, an added burden that wasn't necessary. So for us, I felt like it was something that we had to do to make sure that physically people stay healthy so that they could be there for their families.
If it wouldn't have been for their faith and their hope, and to see them, to cry with these people, to smile with these people, to pray with these people, just to share a laugh with these people, they gave me hope that what I was doing was right.
We are a family. It didn't matter if you were white, it didn't matter if you're black, it didn't matter if you're Hispanic. If you needed help, we were going to help you. And your neighbors, people that you may have not spoken to, kicked in. We became a real, true community, I felt like, during the flood.
That's what you go in the medical career for, is to help people, to reach out to people. And if I never do anything else, it was definitely days worth it.
The employees of Tidelands Health have really and truly shown that they are determined, and they are willing to go above and beyond in any way that they can. And it's not them that matters, it's the patients that matter, and they will do anything to make sure that patients are cared for in the best way that is possible.
We wanted something that we could do on the weekends together, so we bought the kayaks so we could use them on the river and the lakes. And so I thought, well, I'll just use those kayaks to get to the end of the road when the flood comes. So probably that Thursday, I had taken the kayaks out and tied them to the steps. The morning I woke up to go to work, I looked out and I saw nothing but water. Everywhere was water, and I thought, oh, I hope I can get out of here. So I took a shower and got ready, got up an hour early, and just in case there was something to go wrong. And so I got my few things that I needed, and I went down to the steps and attempted to get into the kayak. It flipped, turned over, and I fell right on to the bottom of the water. And when I got myself up, it was ice cold. I'd already taken one shower, but the water was freezing cold. So I had to flip the kayak back, go back upstairs, take another shower. Then I come back, dried the kayak off, and got in the kayak. Any thing that you took with you had to be small so you could put it in the back of the kayak. Took about, with falling into the water and getting back on the kayak, it probably took about 45 minutes to get to the end of the road. Got there on time and did my 12 hours, and I took care of my patients. Patients are the most important thing to me above all, because they're depending on us to take care of them. They need us to take care of them, and I hope that people can take away that in any situation you've got two choices. You can either feel like you're stuck in a situation, or you can do something about it. Just get, you know, it's hard to get up and brush yourself off and go on, but you'll be a better person for it if you can, and the situation will get better.